Hello everybody, I would like to talk to you today about breast implants. As you all know, breast implant is probably the #1 procedures that we do as plastic surgeons. We've had a lot of different options over the years, and now what we have in 2025, we have silicone gel, the so-called gummy bear gel implants, and we have the saline implants. The saline implants are still on the market. We still use them once in a while. They don't feel as natural as the silicone, but they are available for our patients. When we go to the silicone gel, this is a silicone gel, so-called gummy bear, more transparent. They feel better. So most of our ladies prefer the feel of this that imitate better breast tissue. They come in different firmness. Some patients like them super soft. Some others like them a bit firmer. The benefit of a slightly firmer implant is they won't fold inside the body, which we had some issues long time ago with the implants not being as full and where there was some folding inside. They come in different diameter, they come in different projections. So we have the moderate profile, moderate plus, high and ultra high profiles. We've got two excellent companies in Canada making good implants on both sides. So we have also those options for our patients. Now, when we want to put implants inside the chest of a lady, we have kind of three pockets we can put it in. We can put under the muscle, which is favored in most cases. Under the muscle gives an extra support to the breast. I tell my patient the pec muscle acts a bit like an internal bra, keeps the implant in place for longer. Under the breast also has a lesser chance of a small issue that can happen with the implant called a capsular contracture. So going under the muscle is beneficial. There is a slight added amount of pain for a few days, but well worth for a long-term result. Now, there are patients who for some reason want them over the muscle. Some patients have a significant amount of sagginess in their breast, and they are candidate for a breast lift, the mastopexy, but they are not ready for the scars of a mastopexy. So for those patients, if we were to put the implant under the muscle here, with the breast here, will not look good. It's called a double bubble sign. So for those patients, if they do not want a breast lift, but they need one, the implant would be put over the muscle. Now, over the muscle, we can do under the gland or under the fascia of the muscle, which I favor for the above muscle procedures, because fascia will give an extra protection, extra holding of the implant in place in addition to the skin. Now, it's very common to do this with a mastopexy, a breast lift, and in all those breast lift procedure, the implant would go under the muscle. One more reason to go over the muscle would be large implants. If a patient has never had breast augmentation and she wants 500-600 cc's, the implant is too large to go under the pec muscle in one procedure. When we put the implant under the muscle, we have to disinsert the muscle slightly so the implant rides down slightly so that the nipple looks tiny bit above the horizon. If we don't sever the pec muscles, the implant will be too high, as we see with the pec implant in a male. So we don't want this outcome in a lady. We disinsert the pec slightly, and a larger implant would demand a bigger dissection, a bigger release of the pec, which could defunctionalize the pec. So for my own rule, and for many plastic surgeons, we like to keep the implant roughly 425, 450 ml or lesser under the muscle. Otherwise, we go over the muscle. Now, if some ladies had breast augmentation many years ago under the muscle at, let's say, 375 ml, now we can go higher, 500-600, because her pec has been already stretched and expanded over the years. Now, one final question that I'm always asked is, how often should we change them? Now, there were some unspoken rules in the past of 10 years. Now we think about 15 years or so, where we ask our patients to have their breast looked at by their plastic surgeon every 12 to 15 years to make sure everything is okay. If a patient is returning to surgery for breast lift, we change the implants. If a patient is happy with the volume, she does her ultrasound and mammographies and everything looks great, there are no capsular contracture, there's no pain, there's no obvious asymmetries, I often will observe my patient over a few additional years past the 15 if needs be. Thank you very much.